Every time I think I know all those big players with the crazy claims online, I'm surprised that there's so many others out there. This one was sent to me by a colleague of mine, and I really felt that we have to discuss it. So check it out. This trainer named Train Like Ivan, that's from his Instagram. It says the AVSAB tells dog owners that SSRIs will cure their dog, that these drugs will just erase whatever the issue is: aggression, OCD, separation anxiety, fear. But that's not how SSRIs work. What they do is leave the dog numb. If you know otherwise, convince me. I'd especially like to hear from someone actually educated in this field. Explain how. So you're in luck because I'm actually educated in this field. Please listen up. So just so you know who I am, I'm Dr. Orion. I'm a veterinarian and a veterinary behavior specialist. And yes, I use SSRIs to treat some, not all, but some of my patients. SSRIs are selective serotonin reuptake inhibitor, and that basically means that they will increase eventually, it doesn't happen right away, but they will increase the serotonin in the brain to the normal levels, making the brain start functioning normally. Oh, and just before I continue, let me just explain that the AVSAB is the American Veterinary Society of Animal Behavior. It's a group of veterinarians and veterinary technicians that find a specific interest in veterinary behavior. So, Ivan, you probably noticed that I said that the SSRIs will bring the serotonin to normal levels, not to high levels, to normal levels. We decide to use SSRIs or other medications, by the way, according to what we think that the brain is lacking, or sometimes just the opposite. We want to use something that will decrease some sort of function in the brain or some sort of neurotransmission in the brain. There are even studies both in people and dogs that show that if the brain doesn't have enough serotonin, aggression, anxiety, and fear are much more common. Having too much serotonin in the brain can actually lead to something called serotonin syndrome, which might even be dangerous. But even before getting to those dangerous points, it's not going to numb the dog. It's actually going to cause just the opposite of numbing the dog. SSRIs are not sedatives. They're not supposed to cause your dog to be completely numb. Yes, in some cases, when the medication just starts working, it might cause some sedation. It might even cause decrease in appetite. That usually goes away after 2 weeks. But if it doesn't, or if it's too extreme, most of us professionals that actually know how the medication work and not random people online will reduce the dose of the medication or will switch to something else. There's so many different options out there. What some owners might see, and maybe some people that claim to be professionals and are not, might tell you is that it numbs the dog because the dog's overall activity levels decrease. But why does that happen? Well, because before the medication, the dog was, or the cat, was much more active and hyper aroused. And I should actually say hyperactive and hyper aroused than after we gave the medication. And once the dog can actually relax, then he sleeps much more. But he's not a zombie. He's not supposed to be numb. He's supposed to still communicate with you, be happy going on walks, be happy overall, be much more happy than he was before the medication. Most dogs, especially if they're not puppies anymore, spend a lot of their day sleeping. So unless your dog is actually behaving like a zombie, he's not getting up no matter what. If you are able to get him outside, he kind of like drags behind you and doesn't seem to enjoy life, or if he's not eating as well as he did before, those are signs that you should bring up with the professional they gave you the medication. Is it common that the dog will become that bad because of that medication? Not that common. And also, the claim itself is not really by the AVSAB. I didn't even see that he put a link to that claim anywhere. So basically, he's trying to like clickbait you into believing something. So, Ivan, I hope now you're educated and you're not afraid to use these type of medications if a specialist or if a doctor that knows what he's doing and has a lot of understanding in the field prescribe it in specific cases. It's not going to numb your dog. It's not supposed to numb your dog. Will it erase anything? No, it never erases anything. It's supposed to be an additive to a full comprehensive behavior modification plan and in environmental management. It's always a part of the treatment. It's not the treatment. So don't worry, we're not stealing your job. But Ivan, if you have any questions or if any of you have any other questions, please feel free to contact me. Write it down below in the comments. And in the meanwhile, if you can like and subscribe. I know that Ivan is probably not going to like and subscribe, but the rest of you feel free. So more people will be educated as well. And if your dog needs Prozac, if your cat needs Prozac, and you have a specialist on board. In the meanwhile, if you like this video, why not watch this video as well?